In this episode of Optimal Anesthesia, we'll be looking at some of the most important factors in the field of anesthesia. This article will go deeply into risk assessment systems, a subject that serves as the bedrock of your business. We'll break down these systems, their ratings, and the many ways in which they serve as a guide to patient safety. Let's begin with the NARCO-SS system. Think of it as your secret weapon in assessing patient risk pre- and intra-surgery. NARCO-SS stands for neurological, airway, respiratory, cardiac, and other surgical severity. Each of these gets a score ranging from 0, no issues, to 3, severe problems. Surgical severity, graded as A or B, reflects the procedure's invasiveness. Combine these, and you arrive at an overall risk score, low, moderate, high, or higher. A higher score signifies a riskier situation. Moving on to the ASA-PS system, or the American Society of Anesthesiologists' physical status. It's your swift classification system. So, imagine Class 1 as a person out on a sunny day, not a cloud in sight. This individual is the picture of health. It's like they have an invisible umbrella shielding them from any health issues. The chances of getting wet, or wet means a health problem or comorbidity, are incredibly low. Now, Class 2 is like a person walking with a bigger, trusty umbrella. They've got a mild systemic disease, but it's not limiting their activity. This umbrella, representing their health status, provides better protection from most of the rain. They might get a little wet, but it's just a drizzle compared to the downpour. Moving on to Class 3, we have someone with a cap, a partial shield. They've got a severe systemic disease that limits their activity. The cap represents their protection, but it's not as extensive as the umbrella. While they might get a bit wet, it mostly covers their head, making mortality less likely. But, yes, morbidity can happen. Class 4 is a challenging one. Imagine a drowning person. They're in a difficult situation due to incapacitating disease. They desperately need a lifeboat in the form of excellent healthcare services from an efficient team. Here, the chances of both morbidity and mortality are very high. And Class 5 is like being caught in a severe storm. You're unlikely to survive, whether you get help or not. It's a dire situation, and the chances of making it through are minuscule. And Class 6 is unique. It's like a person who's brain dead but can be a hero. In this case, their healthy organs can be donated to save others. It's a selfless act, providing a lifeline to those in need. Don't forget that in emergencies, we add an E to any class. It's like sounding the alarm during a sudden downpour. An emergency operation is needed. Finally, let's talk about JHSRCS, the Johns Hopkins Surgery Risk Classification System. Think of it as a Yelp review for surgeries. It categorizes procedures into 4 classes. Class 1, easy peasy, minimal risk. These are often outpatient or day surgery gigs. Class 2, slightly more involved, but not too risky, like a hernia repair. Class 3, here, you're looking at moderately invasive procedures, and there's potential for hiccups. Class 4, the big leagues, major surgeries that come with significant risk, like brain surgery. Why do these systems and scores matter to you as an anesthesiologist? Because they are your roadmaps. They help you gauge your patient's risk profile. Is it a Class 1 or Class 4 in ASA-PS? Is the NARCO-SS score high or low? These details help you tailor your anesthesia approach, your post-op care plan, and even your clinical decisions. In essence, these risk assessment systems are your guides, ensuring that your patient's journey through surgery is as smooth and safe as possible. So, whether you're in the operating room or consulting with a patient, remember, these scores are your trusted allies. Thanks for tuning in, and until next time, keep exploring the world of anesthesia.